Welcome all to the 20th webinar of Medgini, where we are going to talk about today the patient education cases that create an impact and also deliver good and better health for patients. So today we are going to cut across this particular topic, and we have got excellent line of speakers to talk about on this. Before we start the webinar, there is a we want to know about your location and a background. And if you can please put in the chat, where are you joining us from and what exactly is your background? It will help us connect with you better. Is a request to please keep your videos on and keep your notes ready so that we are going to talk a lot about cases which are going to help you tomorrow in your brand planning as well as in your pharma marketing. So please put in your location as your and your background in the chat. I request everyone to please put in your location and the background in the chat. So we've got excellent speakers who are joining us here. Rohit, welcome Rohit, has joined us from Mumbai. Shubham from Varanasi. We've got Kuldeep from Delhi. Welcome Kuldeep, welcome Suhail, welcome Kalpesh, welcome Ratan. So please put in your background as well as your location where you're joining us from. So let me tell you the 5 benefits which you will be getting joining us today for this particular webinar, which is 20th webinar. It's a special webinar, and we have been consistently doing this since January 2024. We have been talking about various topics which is of relevance to the pharma marketing industry. And today, the topic which we have selected, which is on patient education, patient support, and patient access program, which are executed by various pharma companies. And the 5 benefits what we will be getting as participants, as speakers, is one, to understand how pharma companies run patient education programs effectively, and how exactly this particular patient education, patient adherence program help in terms of adherence, medical adherence, as well as we will also learn from our speakers today about the key metrics which are important in patient education program for creating better business impact. We'll be also talking about some practical tips to overcome the access barriers which normally do come in a country like India, where the culture is very diverse. And we are also going to talk about the upcoming trends which are there in patient access program in 2025. So in addition to the 5 benefits, we also have got a bonus for all of you. The entire conversation that we are going to have today with our speakers will be converting that into an ebook format, which will be released by 6th of November. And it will be given to all the participants who are there with us till end of the webinar. It will be sent to you by email to the registered email ID that you have given to us. We'll also be having an opportunity for people to participate in a contest, and you get a book, a paper book, which is from Subbarao sir, which will be delivered to your doorstep. And the book topic is sentiment analysis for pharma market. Yes, this is 100% relevant. And I request all of you to be active on the chat. And if you have any questions to be asked, please park it in the chat, and we definitely will take it up with our speakers at 1 o'clock. So 12 to 1, we intend to have the particular session, which is going to be an interaction round and which will be covering various areas on the particular topic. So with that, we would now like to have an introduction. The first introduction is about me. I joined in from Hyderabad. I head the organization Medgini, which I started off in 2012. I did my MBA marketing from Symbiosis Institute of Business Management. I have experience in IT, telecom, as well as pharma. I have been recognized by Business World 40 Under 40 in 2021. And I stay along with my parents and my wife and 2 sons. With regard to my passions and hobbies, I love dancing, cycling, and reading. So these are 3 core hobbies which I wanted to share it to you all. So with that, we would now like to welcome our speakers. It's a privilege and honor to welcome 3 speakers for the first time in Medgini webinar. We have got 3 speakers who are from various backgrounds who are going and come and talking to us about patient education, patient support, patient access programs. So the first speaker today for the session is Preetakar. Preetakar is with 25 years of experience in pharma and she has served various companies when we are talking about Novartis, Sanofi, and Pfizer. So currently, she leads patient access and advocacy at Pfizer India. She works to make treatment more affordable and improve patient care. Earlier, she has managed key programs at Novartis and Sanofi, including the SAT Diabetic Initiative across 35 cities. And she has managed top diabetic brands that includes Amaryl, Cetapin XR, and Dionil M. So welcome, Pritakar. It's a privilege to have you here.
Thanks, Ashish. Thanks a lot.
Yeah. And anything that I'm missing from your profile, please, you would like to share it with our participants?
No, it's nicely covered. So I just want to add that I have started my journey from the ground level. That's a medical representative, and that was in Kolkata. And so I have seen all stages in the pharma, how it works, like sales, marketing, and patient support program access. So that's the achievement which I have and worked in different parts of the country. So that's just wanted to add that.
Yeah, certainly interesting. So over this discussion, I will definitely be happy and interested to know what you have done with the SAT diabetic program, which you have run across 35 cities, which is really difficult to imagine, because coordinating such a program at a national level will require a lot of planning, lot of thought process in terms of how it's going to benefit the patient care. So we'll be touching on this particular aspect in detail. Allow me to introduce our second speaker for today, which is Dr. Manoj Kumar. Dr. Manoj Kumar, welcome and happy to have you today.
Thank you.
Dr. Manoj Kumar is the Executive Vice President, SBU Head, Super Specialty in Intas Pharmaceuticals. He has a very diverse background. He's come from a family of banking and investors. He is a regular guest speaker at IIM Ahmedabad as well as Goa Institute of Management. He comes with 26 years of experience of handling pharmaceutical business. He is an experienced leader in oncology, plasma, critical care, and nephrology. His past experience and current experience include Intas Pharma, Novartis, AstraZeneca, Servier, and ICICI Bank. Additionally, Dr. Manoj has also authored 10 research articles in the field of management. With regard to passion, he is an avid marathoner and also a motivational speaker. Dr. Manoj sir, welcome. And today, Manoj sir is joining us from Jaipur. He has been kind enough to accept our invitation in spite of being held up in other conference activities as well. Thank you, sir. Our third speaker for today's session is Mr. Sagar. And Sagar comes with 25 years of experience in pharma. Sagar is a result-driven marketing leader with experience in sales, marketing, as well as scientific operations. He has served in many organizations, including Abbott, UCB, Aristo, and Dr. Reddy Labs. He has spearheaded digital transformation and patient engagement programs in MNC setups, collaborated with global teams for brand planning and cross-market knowledge sharing. He has launched new brands and divisions across chronic and acute therapy areas. He has 25 years of experience. Welcome, Sagar, sir. It's a pleasure to have you here today.
Thanks, Ashish. I think it's really a pleasure to be part of the program, which is patient-centric, because everything what we do revolves around patients, and many a times we do a lot of things, but the center of the stage is somewhere we get lost. So what begins with patient, I think the more time we give to this, I think this helps a lot, because this is the purpose-driven industry where we are. So I'm glad to be part of this event. Thanks, Ashish.
Perfect. So nice to have you, sir. And definitely we'll be cutting across various real-time cases which comes across your experiences, which we are going to deep dive today. So coming to the topic, why have we selected this particular topic of patient access, which Sagar sir was also mentioning that at the center, it's not only about the doctors, but it's also about the patients. So when it comes to patients, patient access program include three major areas to the limited knowledge that me and my team has collected. It is about disease awareness, disease diagnosis, and adherence to therapy. So these are the three areas where we feel it is very critical when it comes to patient care. So what are we going to deep dive today in the session is how exactly patient access programs are implemented, what are the live cases, and what are the examples which we are going to cover today, and what are the key metrics when it comes to patient support program. Emerging trends with the advent of technology coming into picture. There are a lot of things where people are able to do straight from diagnosis as well as adherence, which they use technology, so which we are going to cover that in today's session. How do you measure ROI? As marketeers, we are also interested to know how exactly ROI is measured when it comes to patient access, patient support program. So with that, we will be starting the session today. And the patient education program, we have divided this entire session into 3 parts. The first part, we are talking about challenges, case studies, and insights. So the first question comes to you, Preetha. Preetha, we have seen that you have implemented patient access programs, and we would like to really understand how do you measure the impact of patient access program beyond just the treatment uptake. So over to you, Preetha.
Okay. See, in pharma industry, see, we are, of course, we all are commercial organization and we are not here for charity. So our interest of launching a patient access program is adherence to the therapy, which can give a more business. But this patient support program is something which is a win-win situation where patient gets the benefit if we are successful, and organization also gets the benefit. So as a patient support program person or a patient access program person, my objective, or as an organization as a whole, objective should be, and which is the right objective, that patient should adhere to the therapy and patient should also get values out of it. So overall, patient should get the benefit out of the therapy. If patient gets the benefit out of the therapy, then only patient will continue the therapy, and it's a win-win situation, right? Then your product will also have a better name and you will get a more prescription and more business. But the end result is the product has to give benefits to the patient, right? So now, how do you impact? Your question is basically, how do you impact the, can you repeat the question once again, just Ashish?
Yeah, so what I was checking is that how do you measure the impact of patient access programs? So it's not just about the treatment uptake, but the quality of life, the patient empowerment, how exactly?
So basically, when I today design a patient access program or the patient support program, the KPI which I have to design for the program or for the vendor or for the, any other project, my first KPI for the program is the patient satisfaction. Is my patient satisfied with my services and the program? So it is extremely important. Everything else will, be managed if your patient is happy and satisfied. But that is my first KPI for me and for the vendor or the partner who is running my program and the entire ecosystem. If I can show that with this program, my satisfaction level of my patient is very, very high, then I can say that my program is successful. Okay. And definitely other than that, which is we have to measure the adherence to the therapy. Is my patient adhering more? If a patient who are not in program and patient who are in program, are they adhering to the therapies more? Okay. And to adhere to the therapies, then you have to work backward. It's adherence of therapy is just not giving the medication and giving a reminder to the patient. It's basically a change of mindset. You have to work on the mindset of the patient, that why this drug is important to you, how it is working for you, and what are the benefits you're going to get. Because today in our country, doctor-patient ratio is poor. Though we publish that we have a very high doctor-patient ratio, the fact is not that. So today, doctor doesn't have time to explain patient. So patient doesn't know, like, this medication is given to me, how it is going to benefit me. What are the benefits I'm going to get out of it? So here comes the role of a patient support counselor. So we have to explain to the patient that how it is going to benefit them and what are the benefits that they can get out of it. If we do that, from there, we can get a much, much better adherence. So I would say the measurement of this is the first is the satisfaction, then adherence to the therapy. That is, of course, is a numerical value which we can see. Other than that, it will depends on different disease area. Okay, so each disease has a different area to measure that whether your patient's program is successful or not. If it is a diabetes program, and if you see that after giving the program, patient HbA1c levels are really coming down, then is much better. It's actually coming. Then in that case, you can say that your program is successful. If it's psoriasis program, is there other parameters which is getting improved, like the PASI score? So wherever you can measure the parameters, there you can clearly show that the patient support program is working. And you just mentioned in the beginning of the question, quality of life. So each disease has a different scale for measuring the quality of life. So we have to use this quality of life of questionnaire to understand then how we are impacting in patient lives. So it's a therapy adherence, basically. It's not a medication adherence. So whatever guidance or the lifestyle modification needs to be done, in that case, am I able to create any impact? Okay. So, and that can be measured through the satisfaction score, quality of life score, different, pathological parameters, image, all these things can be measured. So it has to be customized for different program. Yeah.
Okay. So, Preeta, just a follow-up question. You had executed a very big program, which was across 35 cities that we have seen in your profile. When you have executed this patient access program, what is the timeline you kept that, yes, I will see the result, whether it was successful or it has failed, probably after 6 months, 12 months? What is the gestation period that you actually give for such programs which are launched at that magnitude?
Okay. See, the SATSAR is one of the longest program. I think my colleagues from Sanofi is there today in the audience. First of all, let me give you a disclaimer. Whatever I'm telling is my own opinion. I'm not representing any organization here. So SATSAR is still continuing, and it's much bigger today when I left in 2016. And so patient support program, when you are launching and when you want to see this successful, organization has to have mindset for the long-term view. It's not a short-term gain. Okay, 3 months, 6 months down the line, you can see some benefits, but you have to run it years after years. See, diabetes today is much awareness we have created. And when we started many years back, that time people used to ignore diabetes. But today people are, quite conscious about diabetes. They do the screening, they go for the testing, they go for the medication, they go for the exercise and diet. So this is a long term. I cannot tell you it's a 6 months you can see the impact, but definitely minimum 1 year you need to see the impact. If you really want to see a short term, less than 1 year, it's very difficult to see the outcome because 6 months will take for the setting of the entire program. Yeah.
Perfect. And with the advent of technology, we have seen a lot of startups where through face scan, you are able to read the HbA1c in less than 60 seconds. So we are talking about the accuracy of it. But yes, this is a new advent of technology, which is helping companies or helping organizations for doing mass diagnosis of diseases at a very quick, cheaper rate. So this is something which we are seeing. With that, Dr. Manoj, we have the second question for you. When we are talking about super specialty, you are served in organizations like Novartis. And while we were talking, you have told that the first patient support program, while you have executed in Novartis, I'm sure it has been long back, to 2025. How things have radically changed. What's your insight in terms of how to actually do it with the advent of technology?
Sure. Thank you for the question. See, when GPAP got introduced, which was a Novartis global program, it was called Gleevec International Patient Assistance Program. And it was way back in 2000. So I'm talking about a story which is 25 years old. And that came with a vision of, the organization and then chairman, Dr. Daniel Vasela, and he made a statement in White House and for a path-breaking drug called Gleevec, which was a kind of a magic cancer bullet for chronic myeloid leukemia, a kind of blood cancer. And he said, those patients who don't have a capacity to pay, are not reimbursed, do not have a means, shall be given this drug free, and which was a big statement. And many of us have seen this journey of this great company, Novartis, where, patient confidentiality was maintained. There was a watertight compartment between the pharma professionals and the patients, absolutely no interaction. A NGO was roped in. Some other sessions will tell you how did we go about getting the NGO on board, who probably would be the only sole point of contact between the patient, because with the business side there was a there was a commercial angle, and the NGO was more interested in serving the patient, and they reached out directly to the hematologist of the country, and they kind of ran this program. Subsequently, when I was there, this was converted into an access program, which was called Novartis Oncology Access, where whatever was the paying capacity of the patient was introduced. And this was again another innovative thing where patient was evaluated based on their paying capacity, and whatever they were not, whatever they was beyond their capacity was provided as an access. So again, another innovation where they chipped in a financial evaluator. Okay, so you had an NGO, you had a financial evaluator, and then the medicine was distributed from the appointed CFAs or distributor. Okay, so the patients were given complete access, a lot of security, and it was very heartening to see such deadly disease getting converted into manageable disease. When I see patients of CML on imatinib therapy or on this program, even after 10 years, 15 years, it is so welcoming. Coming back to your second question, how it has evolved over a period of time. And your program today is dedicated to the concept of access. I think, frankly speaking, the very pharma industry today, if you look into the macroeconomic picture, is an access model. Okay, otherwise, what should have continued was only innovator. The very concept of generic and branded generic is an access model. Okay, imagine a situation where only the innovators would have continued in the world. How many of us would have been surviving so far with this deadly disease? Practically impossible. If you see the increase in lifespan every decade, it has a lot to do with the kind of access model which by the introduction of pharmaceutical company exists in India. Are you getting me? So the very concept of access have started with the concept of generics and branded generics. I think the concept what macro picture provided was the Ayushman scheme, the kind of insurance coverage model, the kind of support which exists at various ecosystems are again another lever which was used in the access model. I think the frills which got provided by the government also improved the access. So that's talking about the macro. In the micro level, I would not typically try to typecast into one particular company, but almost all of us, all good pharmaceutical company has got a full free program, then a co-shared program, and then also a compliance program. Further to the compliance program, there are also correct dosing programs. So how do you increase the diagnosis? How do you increase the treatment? How do you increase the compliance? How do you increase that correct dose is given? Now, initiation of a therapy is okay, but completion of a therapy is much important. Imagine a cancer patient who gets diagnosed of an example, say a breast cancer, and the patient is supposed to take 18 cycles. The patient starts with one cycle and doesn't complete the cycle, all those 18. The patient won't be surviving. So what's very important is, and I think we as Indians should feel very proud that we have kind of given an access program to the whole world. Imagine a situation if so many good companies would not have been manufacturing medicines. so many of us would have been dead. Imagine a situation when the vaccine which was manufactured by Indian companies were not there. We would have been dead 5 years before. There were great companies which provided an access model, ensuring that we breathe easy and we breathe alive.
Absolutely. I think I resonate with what you say, Dr. Manoj, and the classic case which we have seen long back when in Africa we were talking about HIV as a major challenge, and the affordability of HIV medication and therapy was not so easy. Team, can we meet all? Can we have just the speakers on? Yeah, thank you, Surya. So we were talking about Cipla as a classic case, and the point which you have made today is making it affordable for better access to the masses. So if you want to have patient access program, the various models definitely is something. But I would like to ask you one thing, Dr. Manoj, in follow-up to that. Insurance adoption today we have seen at various levels is very less compared to what we see in other countries. So is that also going to be a critical factor when it talk about patient access program? Ayushman Bharat, definitely you have mentioned about it, but going forward, do you feel insurance will play a very critical role when it comes to patient access programs?
To answer to that, I'll give you my practical example. I just doubled up my insurance coverage. It ran into few crores. It has further gone up because I just happened to see a very close relative of mine on ventilator for 100 days. Now there are a lot of treatments which are going to become a reality. Today, a gene therapy is costing you 13 to 15 crores. Today, a CAR T cell therapy is costing you crores. Today, one full complete cycle of immunotherapy may be costing you a few lakhs. Today, there are various curative treatments which is available at good price. Okay. Now, it is very painful when you see your own uncle, auntie, mother, father having a treatment and not getting it just because of just because of lack of fund. Now the awareness level is going up. Awareness level is going up. When I started my pharmaceutical career, nobody talked about health insurance. Forget about health insurance. People did not have, even the car was driven without insurance, right? Then the concept of insurance came in, and I very vaguely remember there were only 4 different kinds of coverage which was there: CGHS, ESIC, RNR, Army, and Railways. If you are an employee of these 4 places, you are damad. Rest all places, you fed for yourself. If you are a private employee, then God help you. God helps you. Okay. Best is to jump from a cliff. Now, the coverage have started increasing. There used to be just one government health insurance company. Today, you look into the number of penetrations which has happened. Okay. There are many players. In fact, there are offshoots. Having come from banking industry, I can also tell you that, insurance companies also take insurance. So, that's why you see ICICI Lombard. So you have double insurance coverage, which is already entering into India. And then government is also very keen. The healthcare spending has gone up 1.6 to 3.3, if my memory serves me right. So you see a lot of cohort rising awareness in patients and caregivers. Then you see government very serious about it. Then you see, curative treatments coming in, innovative treatments coming in, but it comes at a cost. So people are getting aware about it. So I think 10 years down the line, a large majority of us would be having some insurance or the other. And that's what you see. If a country's vision of becoming a 3 trillion, I think that was the vision. That also encompasses that almost 80 to 90% of us would be having, and that's what you see in the developed countries.
So adoption to insurance is definitely going to happen, and it's going to happen at a very rapid pace because the awareness level is definitely going up for the patient. They are realizing that the therapy cost is going up, so you would rather bug up
I'll tell you an
take
example.
whatever comes to your way.
Ashish, I'll give you an example. There are close to 100 of us or little more than that who are a part of this. Just write yes or no, those who have insurance and health insurance, and those who don't have health insurance. You'll get the answer. See the response. There is no.
If at all anyone is answering no, probably bug up and do that as fast as you can.
Yeah. So there you go.
Okay. Yes. So next question we have for Mr. Sagar. Sagar, you have worked across various areas, be it chronic and be it acute, and you have seen this access programs. You have implemented access programs across various organizations. So, what are the three important challenges that you feel when implementing these access programs when it comes to chronic therapy? If you can give us some example related to respiratory or probably related to chronic, because Dr. Manoj has the example of super specialty, and Prita comes with the example of MNC companies. You have a very good example, very good experience coming from various companies. So please give us example from chronic therapy perspective. How exactly this patient access programs? What are the key challenges which we normally face?
Thanks, Ashish, for the question. See, I have been looking at this patient support programs, being from the field side because I started my career as most of us, like a medical rep, and I have seen companies like Dr. Reddy's having patient support program in diabetes long back in 2001 and 2, so around 25, 26 years back. And moving forward, I also had a hands-over experience in having a patient support program. In fact, revamping and rolling out for epilepsy, which was Life Beyond Epilepsy. In fact, that was for UCB, and it was not just in India. We replicated that successful model in other countries as well, in the APAC regions, where they failed to manage this program. If you talk about the high treatment costs and the chronic diseases, one of a very difficult disease and treatment perspective, it was like for multiple sclerosis, where the treatment cost per month goes more than ₹1 lakh for just survival of the patient. So I have been part of that program as well. And the recent couple of years, what you're talking about respiratory, I know that's a flagship program with most of us might have heard, and I have been integral part of this program. So when you talk about challenges from a majorly chronic perspective, I'll talk about, it is always that high treatment costs. That becomes one of the major problem. And when we talk about treatment costs, and there comes the role of insurance as well. Now, most of the people in the chat box did mention that, yes, I have insurance. But if I go to what Dr. Manoj was talking about and therapies available, forget about that therapies. Even a normal hospitalization today, with a fever or something, if you spend 10 days in hospital, it will exhaust your medical policy. The average medical claim policy, what you have, health insurance, that gets exhausted in 10, 15 days. Because there are comorbid conditions also running.
You are saying it's the coverage which critically matters.
Yeah. So it is not just having a policy. It is just like someone is going for normal air for your car, and the other one is going for nitrogen. Do you know what is the difference between both? When you go for only nitrogen, how much the content of oxygen in that? नहीं, बस nitrogen अच्छा है इसलिए डालो. जैसे insurance अच्छा है इसलिए ले लो. कितना काफी है? Nobody asked. Only when you or your near and dear ones get admitted, you realize that this policy was not sufficient, because a normal fever itself takes a couple of lakhs. So, and with the corporate hospitals and these things building up, it's becoming costlier and costlier. So, we need to address that question as well. Coming to that, if I talk about more about respiratory, other than the high treatment costs, which I was talking chronic, here it may not be always a high treatment cost, except the bronchiectasis and all those cases which are more chronic in respiratory. But there is a complexity of devices. So there are so many devices, right? And when we talk about access and support, how do we manage to educate patients on different devices if you want them to use at home. Because see, taking a tablet or a syrup is very easy. For an injection also, you can go to a nearby general practitioner and get it. Okay, my onco or my neuro or my ophthalmologist has given this injection and I need to get it. So be it IV or IM, that's it. It gets done. But when you have to use a multiple different kinds of devices in a right way, unless and until it is not used in a right way, it is of no use. So this plays a role. Moreover, even I'll talk about many times if the dosage is in like not just a OD or a BID, which you can take at home. If you have to take something on a maybe TID or a QID basis, you are either at work or at school or somewhere in the public places. Social stigma is even today there. See, people don't mind telling ki I've got a maybe high blood pressure or maybe diabetes. That's like a still accepted one. Suppose if I'm talking about someone, I have worked in the mental health space for almost 12 years. How many people will tell that I'm going to a psychiatrist? Because वो पागल का label लग जाता है. It is not taken sportingly. Forget about that. I was part of one of the project that paper was published and there's even there were very high-end authorities were part of that. A lot of neurologists from across the country, from UCLA, there were participants coming from abroad. There were NGOs part of this. The project was on marriages in epilepsy. How many people will marry a girl if she's a epileptic? The question was thrown in that room only, ki, will you marry your son to a girl who is having epilepsy? So what happens is that acceptance and taking the medication in a public, it's difficult. Similarly, even for asthma and all, though so many years the education is there, celebrities educating. How many people can take out the inhaler and take it in public? That social stigma and isolation is there today also, right? Though Wasim Akram playing a sport for a diabetic and taking insulin, so has come a long way. But abhi bhi, taking a tablet is different and having an insulin pen and doing it in public, people may not find it comfortable. So be it acute, be it chronic, I think that stigma, isolation, it is there. I'll talk about maybe the cost of the therapy. It is very important. There's a limited access to specialists also, because when we talk about the population of the country, if I talk about 140 crore odd where we are standing. If we talk about Parkinson's, we have what? 150, 200 specialists who actually can treat Parkinson. If you talk about maybe multiple sclerosis, again, the same number. Just imagine only 200 doctors who can actually treat these kind of diseases. If I talk about the simple thing, सांस लेना जरूरी है जीने के लिए. So maybe a pulmo rehab centers. How many cities do have pulmo rehab centers? Right? The respiratory therapist, is that concept evolved? So these all things are very important from this patient access or support perspective. Moreover, how many companies do run the patient support programs today in all the languages and in a right way? There are few companies who are able to do it rightly and few not. And so what happens is, many times the literature also what we get designed, we get it translated from one of the agencies, we get it checked from one of a field person, whether it is right, wrong. But it is moreover at a superficial level. So maybe English, Hindi, Gujarati, Marathi, they are able to manage because most of the offices are either based in Delhi or Mumbai or maybe Bangalore or Hyderabad at max. But all other languages and all that, I'll say it has to be customized. It has to be tailored as per the patient needs. So there are this lot of challenges, and of course the insurance reimbursement issues comes. And most importantly, I feel from a patient access or support perspective, though we have that education on drug interaction and all, but at a local level, suppose in a rural area or if somebody is on some drug, if he's additionally put on an immunosuppressant, the risk of putting on an immunosuppressant for a long time till the next visit he goes to the doctor is very high, because this is what is commonly seen, especially post-COVID. Many people get admitted for something else and we lose the patient for something else because they are on immunosuppressant. Because many of the immunosuppressants, the time to wean off their effect is very high. And in the meantime, the infection sets off in a lot of other organs and this leads to complications and we lose the patients as well. So I think these are like a couple of challenges which are there from different perspectives.
Yeah, the point rightly mentioned. So the point which resonates to me is the social and the cultural stigma So we have come up into a place or a country where really people get curious whenever you take a medicine, and you feel shy about it. So definitely that is a mental block, which I think over a period of time, people should get matured. The society should actually take it in a very positive way, that this is very important for the people to actually follow the therapy. This is a very, very practical issue, which we see that people go in, but as in when we go, the maturity is actually coming up, is what we are seeing definitely. You have also mentioned about the treatment cost being definitely a major hindrance, which Dr. Manoj has also mentioned about it. And there are insurance, there are access programs which are making it affordable for the masses. So with that, Sagar sir, we have the next question. We have a contest. We have a contest which we wanted our participant to come and give their responses. So this is a QR code. I have just kept this QR code. If you are able to scan the QR code, good enough. If not, my team has put a link in the chat. Please answer the question. The question and the multiple choice answer is also mentioned here. The person who answers the right and the fastest will get a paper book from Sentiment Analysis for Pharma Marketeers. The author for the same is Subbarao. Subbarao sir has written so many books in pharma marketing, which I personally follow, and he has been there in the industry for a very, very long time. And we request all of you to participate into the contest. Surya, can you please put the link on the chat? Yeah, thank you. So if you can click on the link, and if you are done, please type in done. So we give you a minute to participate, and then we can proceed with the session accordingly. So you have to just type in your name, your number, and the question is, what is the most important factor that determines the long-term success of a patient support program? So this is 4 options that you have. You can select any one of them. There is obviously one right answer, and based on which we will be able to give you the winners will be announced at the end of the session. We intend to close the session by 1:10, and post which any kind of questions you would like to ask the speakers, please put in the chat. We'll be happy to take it up after 1:10. Thank you so much. So we have already people who have participated. Thank you. Yeah, so many people. Ramesh, Himank, Ankita, Kalpesh, Alok, Sohail, thank you. Chaitanya, thank you. Vijay, Bhagwati, Suryakant, Ableshwar. That's nice. So we give another 30 seconds for people, and then we'll continue our session. And we'll be having another 3 questions which we'll be asking the speakers today. If you're done, please type in done in the chat. So the next part of today's session, we are talking about emerging trends and the key success elements when it comes to patient access programs. The question is coming your way, Preetha. The first question which the team would like to ask based on the feedback that we are getting from the participants is that what are the emerging trends in patient access programs for high impact therapy like oncology? Can you please share some examples which are happening across the globe or in India where patient access programs has created a great impact when it comes to oncology space?
Yeah. Thanks, Ashish. Again, it's extremely important questions, because oncology is the field where access is extremely critical, and most of the companies, they are having access program for oncology. So oncology, definitely the first challenge is the affordability, which you have to address. And for that, we have all kind of access program to, help the patient to afford the medication, because all the research molecules are extremely expensive in India, and which very difficult for a normal people to, access. And all the innovative therapies, most of the government insurance and all these places are not covered. If you say the current trend which you're asking for, I think the most important trend today is to understand the patient journey. So understanding patient journey step-by-step manner is extremely important before you start any patient support program, or if you run a patient support program. And the program has to be designed as per the different, stages of the patient. The early stage, late stage, end stage. Each stage's requirements are different. So designing the patient support program as per the patient journey is one of the most critical things which, many industries or many companies are doing. Secondly is the, digital intervention. As you rightly said, today we talk about digital. Recently, I spoke about AI. So digital intervention for the faster process. Process is another thing which is very cumbersome in many places. And I myself face lots of questions and challenges every day. But organization has to do some processes, like, because there are lots of chances of misuse of your product in the access. So we have to, be stringent in each stage, whether the prescription is right, whether your patient is genuine, whether the patient is survived, it's there, because mortality rate is very high in case of oncology. So verification of the patient, verification of the prescriptions, verification of the product, everything is extremely important. So this process make little bit of, cumbersome for the patient, because patient is already, going through a tough phases in their life, and then you ask so many questions to give them a free drug or the access solution. So there, I think the digital intervention to make the process simpler, it's extremely important today. I'm talking from the operational point of view here, and which we have seen in our, different programs where the digital intervention has made life much, much better and faster for the patient. But at the same time, I always believe that digital alone is not the solution for the patient. It has to be digital. So there has to be human intervention, there has to be digital intervention, there has to be handholding of the patient to explain the digital solution, because most of the patients are unattended. They don't have the children at home, children are away from them, they are staying alone, aged people. So extremely important that there has to be digital solution, but you have to handhold the patient to adapt the digital solution. That is important. You can't just go all about digital. If you go all about the digital, and I'm telling you, people may tell me that I'm orthodox, I'm not moving with the time, but I strongly believe only digital is not the solution for the patient. And still today, I believe that. And secondly, for the oncology cases, the most important thing is that, that if we have seen any oncology patient at our home, we have seen the initial days, people will be, there with you. But after that, people will move on with their own life. Patient will be left alone. So that psychological pressure of the patient is extremely important. So it's important that we, address the psychological issues of the patient, whatever way, digital, physical, webinar, whatever way you want to do, you have to impact the patient's psychological, barrier which they are having. Because depression is one of the side effects for the oncology patient. And then another important thing for oncology is the side effect management, because side effect is something which is very, very severe, most of the oncology drugs, because they are on multiple drugs. Side effect management, if we can really create impact, and side effect management cannot be done alone by the patient support program team or the patient access team. It has to be done in collaboration with the doctors. Whatever you are doing, working on the psychological aspect or the side effect management, you have to do in collaboration with the doctor, create the program, customize the program, and implement that. That's the fourth important thing. Last part, which I would like to add here, which is extremely important, that giving only the access drug is not the solution for the patient, because that doesn't always address all the affordability challenge they have. You can help patient many ways to overcome the affordability challenge. Like, we have so many funds available in the market. Government have so many options. State has funds, center has funds, the PM funds, CM funds. But most of the people are not aware how to access that. Can we help patient to achieve that, get that? So you can design a program to handhold the patient to get those funds, at least apply for those funds. They may not be getting those funds. So to sum up, the current trend is to analyze the patient journey, design the program as per the patient journey, address the affordability challenge in different ways, not only by the free medication, work on the psychological aspects of the patient, help patient to side effect management. So these are the 4-5 points which I will highlight as a trend and extremely important for the oncology program.
Yeah, perfect. I definitely understand from where you're actually coming from. The critical thing which probably connects with me is the mental support. So I understand the situation of a patient which goes through a oncology, a cancer journey. And this particular area where we are talking about the mental support becomes a very important, not only for the patient, but also for the caregiver. So this is programs. There are various companies who have actually given mental support programs, and which is practically not possible for a doctor or a hospital to provide the same. But yes, pharma companies can definitely play a very important role when it comes to patient support program using mental health as a critical factor.
Yeah.
So with
But
that,
one more thing I just want to add here, Ashish, the mental health still is a taboo. People will not accept that they have a mental issue.
Yeah.
You have to identify that challenge and you have to address that with different various ways. Maybe a yoga session, maybe a meditation session. If you say, I'm going to arrange your session with a psychologist, they will not agree to that. That taboo is still there.
Agreed. That's a good point. So, so with that, Dr. Manoj, we have the second question which is coming your way. What are the metrics, according to you, you should consider most important to evaluate the success of a patient access program? To term this program as a successful program, we have heard from Preetha. She has told that minimum you have to give 1 year of time to let the patient access program roll out. And then you see the fruits coming of the same, provided you bow it or probably you sow it in the right way. So what, according to you, are the factors where you feel that, yes, this patient support program is successful?
I think before I get into the numbers of metrics, what is equally important is couple of satisfaction index. For example, patient satisfaction index, the doctor satisfaction index, the nurses ease of administration satisfaction index, and availability index. These things are normally not measured by most of the pharma companies. Another area which doesn't get measured is what kind of market or patient's benefit it has given to the patient's community. See, I run my program, you run your program, Pritha will run her program. But have you seen, today I'm in Jaipur, and while I was coming from airport, I saw, jewelry shops in the same lane, food shops in the same lane. And they were not one, there were 5, 6 of them. Okay. Barber shop in one lane. And we Indians do not realize why this happens. It happens because if this barber is not free, I will at least get a haircut from another barber, but I'll get a haircut. That's my need. If this jewelry shop doesn't have my jewelry, I'll get it from another jewelry shop. So you basically advance towards that particular lane. Wherever you have various access programs or various support programs on a disease therapy, the treatment rate has always increased. For example, right now you're talking, almost the whole world is talking about obesity pills, right? Or obesity injectables. And suddenly what have you realized? That a large majority of us have started, evaluating whether this is workable or can I recommend it to somebody. So the overall treatment for obesity has gone up. So first matrix is on the numbers, how the market or the treatment rate have changed, whether by my company or by other companies. Because if you are able to increase the treatment rate, eventually you will get a pie, number one. What is equally important is, how are the affiliates which has increased? For example, Pritha was talking about cancer. There were many associates and frills in cancer, not just the drug. Whether you have a proper diagnostics marker, whether you have a proper TNMN classification, whether you understand what is the NGS sequencing, what is the biopsy report, and all this leads to, again, a treatment. Whether if a cancer is in a very advanced stage, and let's say a very deadly cancer, some of us would decide not to take a treatment. Instead of dying from a drug or radiation, let me die in peace. Let me go to Haridwar. So that also is a very big market, treatment. Diagnosis rate, treatment rate, then comes whether on therapy or whether on Ayurveda or whether on homeopathy or whether on naturopathy. That nobody evaluates. That is also, again, another important yardstick. Once the therapy segment comes in, then comes whether it is on your drug or your padosi ka drug. Okay. Once the patient comes on your drug, then is what is the continuity, which we call it compliance. Once the compliance is done, what is the dose? Is there a dose modification? Is there a dose change? And how many patients have actually completed the therapy? And then when you go into critical care, it has got to do with new adjuvant, first line treatment, second line treatment, third line treatment, and also palliative and pain management, which is end of life care. Once all this is evaluated and you keep a proper crux, and Pritha, I may add that there are various markers which you see at the time of starting a therapy. There are few things which you need to evaluate after third month. There are few which you need to evaluate after 1 year. And there are few things which is impact quotient, which you need to evaluate after 3 years or 5 years, how the whole landscape have changed. I'll give you an example. The GPAP program, which was started by Novartis, a great company to work with, changed the landscape of leukemia treatment. Before this, if a leukemia CML was announced in the family, people would say, go to Varanasi, go to Haridwar, go to Rishikesh, or do whatever best you can, because death is inevitable. This changed the picture. And suddenly, this created a lot of positivity among patients' community. So, all these parameters defines the index which one should evaluate. So, soft skills, soft numbers, and hardcore numbers. And benchmarking is very important.
Right.
Yeah.
So you have told about awareness, you have told about availability as in treatment options, alternate medications, affordability for the patient, and more important is the continuity, compliance, and completion. So these are the points which I definitely understand, which are very, very critical when we are talking about measuring the success of a patient access program. And also the journey. So you have rightly told that every patient goes through a different journey, and it's very important for you to measure where exactly the patient really stands and what kind of support does he or she may require at that particular stage. So rightly pointed out, Dr. Manoj, thank you so much for the insight. With that, I come with the next question to Dr. Sagar, Mr. Sagar. So, what are the future trends do you see in respiratory patient access programs that marketeers need to anticipate? So, we are talking about the future here. So, what are the things that you feel in respiratory patient access programs that will really be a game changer, probably 5 years down the line?
See, I think one of the major thing what is going to come up 5 years down the line is because currently there is a lot of a digital divide. What is happening? We are trying to use a lot of digital modes for patient education, right? Most of the patient support programs have digital modes, but there is a not everywhere it is being able to use it in a right way. So that will change in next couple of years in a big way. Second is I think this telemedicine and the virtual educators, which was like it started, I think major, it got a boom during the COVID period. But somehow, post that again, it has gone a little bit on a backseat. So that will be one of the big thing which will be coming up. To the point, what even Preetha was saying, I resonate with her. I think the tailored treatment plans will be there in the next couple of years, because what happens is every patient is different. We cannot have a blanket patient support program. And taking from a point from Dr. Manoj also, the gene therapy and all. So I think that is also going to be there in respiratory. Moreover, these treatment plans will be more tailored on the genetic profiles, lifestyle, environmental condition, geographical variations is there, right? Pharmacogenomics is going to optimize this medication efficacy and safety. We have seen in last couple of years this wearable technologies, like we have the smart watches and all for heart rate and all. So pulse rate monitoring. Even in the respiratory space, I think this will be a big thing which will be coming up from that perspective. When we talk about the future trend perspective, virtual consultations we discussed, wearable we discussed. I think AI, though too early to comment, but AI-powered monitors for real-time insights for the indoor air quality or something like that, that can be there. Because if you see some of the chronic conditions in respiratory, like COPD patients, they have the exacerbations and all. So maybe AI can detect ki, okay, now you may be prone to another this thing, or in asthma, you may be prone to asthma attack, right? So what happens? These couple of things, I think in next couple of years, is going to be more clear and monitorable with the help of AI and this machine learning. And then, of course, even in the hospitalized patients, this AI-driven respiratory support systems in the big corporate hospital systems are definitely going to come up, and that will help customize the treatment for that particular patients. So that is from that end. From the regenerative medicine, if you talk about, I think gene therapy and stem cell therapy research that is going to contribute over here. Uh, So, because regenerative medicine for restoring the lung function, because what happens in some of the cases like bronchiectasis and all, the lung already gets damaged by the time you start the treatment to around 40, 50, 60%. And it is only a progressive one. You cannot reverse it. So, how do we restore the lung? Right? When we say that, you might have heard a lot of, I think, statements like, let's paint the lungs pink, because actually they are pink when we are born and all. With the exposure to different kind of smokes and the patterns, that's how it turns. And it just like your heart, the uh, muscle atrophy happens. Similar is your lung also gets hardened and it turns black. So I think this lung restoration is one of the things which in next couple of years will be there. So these are, I think, the couple of things which will be there. And from a patient perspective, definitely things are going to change. More awareness coming in. Coming to the first point, what you were also talking and Dr. Manoj was also talking about the insurance and all. I think even the government has taken corrective steps. If you have seen recently, the tax on the policies has reduced drastically. So the insurance cost has come down. So if this is propagated well and more insurance coverage coming in fact, that will also increase in the next couple of years from a future trend perspective, I think, what we are talking about, the penetration and access. So that's where we stand. And I think if we are able to reduce the hospitalizations by predicting that there is going to be a next attack or something, the more lives will be saved, treatment cost will be lowered, and even the HCPs will find out more easy to manage the patient rather than managing at the end stage.
So all your examples, you are talking about how technology is going to play a very, very critical role when we are talking about future trends in terms of good health, better health, and proactive health care for respiratory as well as for any other treatments. You're talking about wearable as a very important technology which is going to help patient monitor proactively and reduce the hospitalization rates, hospitalization inpatient flow. So this is very very insightful input that you have shared with us today. And with that, we come to the end of the session. We wanted to take 3 more questions, but due to paucity of time and plus there are certain questions which a participant would like to ask the speakers, which we want to take it up. Before that, we would like to take your feedback in terms of the session topic as well as the value that we have delivered to you today. So my team would like to put a link. Please click on the link and give us your feedback in terms of how has been the session useful to you. The points that we have discussed today, do you resonate and do you like to implement the same tomorrow in your brand plan or in your marketing activities that you're planning to do for your brands? So please put in your particular feedback on the link that my team is providing today. Yes, so we have got Surya who has given us the link. Please click on the link. And yes, so a background about Medgini. Medgini as an organization, we started off in 2012 with the whole objective of helping pharma companies to connect with chemists and doctors. We have been helping pharma companies in terms of providing both digital as well as physical solution when it comes to awareness, availability, accessibility, as well as mobility and visibility solutions. So we have helped a lot of companies across various areas when it comes to the critical components of marketing and the critical stakeholders of marketing, be it doctors, patients, and chemists. So we have serviced various companies with the help of technology. We have done campaigns which helps them in terms of driving availability programs, and also run programs which help them monitor patient camps. So this is something, and we are physically based out of Hyderabad, Mumbai, and Bangalore. You may reach out to us if in case you have any such programs where we can help you expedite this particular journey. So with that, we have now the winners from the contest. We have got two winners. One is Mr. Suhail, and the second winner today for the session is Hemank. So, team, can you please spotlight Suhail and Hemank if they are there in the session? Congratulations, Suhail. Congratulations, Hemank. Hemank, congratulations. Congratulations. So, as a token of appreciation from Medgini to the speakers today, we are also giving a gift, which is a book, a hard copy, which is from Subba Rao sir. This is a latest book which is going to be published and released next week, and we are the first one to grab the copies for you, which is on Beyond the Molecule, which is a very interesting book from Subba Rao sir, which we'll be sending your way. And on behalf of our speakers, Preetha ma'am, Manoj sir, Sagar sir, we would like to thank all the people who have come today and asked questions. Yes, we are going to take up the questions which you have shared with us. We would like to really thank you for your time today in today's session. And yes, so yeah, so Alok, we take your particular question. So Alok is asking, as India emerges as an epicenter for diabetes and continues to face growing burdens from oncology, respiratory, and other chronic diseases, how can artificial intelligence be effectively leveraged to improve early diagnosis, personalized treatment planning, and long-term disease management? What role do you see AI plays in bridging the gap in patient monitoring, adherence, and access to care in these therapeutic areas? Preetha ma'am, you would like to take the question from
Yeah.
Alok?
Yeah, I will.
Yeah.
See, the challenges of running a patient support program, as I said, we discussed multiple issues. The major issue is the cost. It's a huge cost which you have to part for this running the patient support program, where you may not get the direct benefit all the time. You have to wait for the getting the benefit, and you have to derive the benefit out of it. So that's in the today's era where PNL is always a question mark everywhere. There's a stress on the PNL. So it's difficult for people to invest so much on this patient support program. And also, second challenge is in the patient support program is the reaching out to the people. I think Sagar has mentioned in one of his conversation, the reaching out to the people, last mile of the people who is living in the interior. So if you are designing a program, you should reach out to all your patients, right? So I think these 2 points can be leveraged by the AI. So you can make it more cost effective, where you may not have so much of human intervention. You can use AI to educate patients, to give reminder to the patients. It can be customized as per the need of the patient. So I think the accessibility can be enhanced significantly with the help of AI. That's what I feel.
Perfect. So there is one question for you, Dr. Manoj. How many times, even after education, patients rely on social media misinformation? How can pharma companies play a role in terms of balancing ethical communication and still effectively counter myths among the patient? Have you seen any real-time examples? We all are having so much information today, right? So how do you ensure that the right education is given to the patient in terms of not to get carried away when it comes to social media information?
Yeah, sure. A doctor takes close to 10 to 15 years to reach his super specialization. And then we use just our few fingers and a time spent of less than 1 minute to diagnose cancer, and less than few minutes to also come up with treatment of cancer. There is, in India and across the world, there are few billion doctors now. and uh, everybody is a Google doctor or everybody is a Google patient's caregiver. And this was a part of my research, which got me a PhD as well. So almost 80 to 85% of patients or caregiver do some kind of Google before they reach out to a doctor. Now, obvious it is that something which got completed in 15 years, you won't get that same information by using your fingers. So I think the first education by pharma company is all you need to Google is find the best doctor. That's all. And don't
Absolutely.
Google anything at all. If my son needs to understand cricket, he need not come to me. I don't even watch cricket. He needs to go to somebody who is a trained guy. So most of us in pharmaceutical companies starts talking about a drug, which is a big time no, especially in social media space. All that you should talk is anything which increases the diagnosis, anything which increases the treatment, anything which gives some degree of positivity so that the patient reaches out to the best possible care, and the kind of ecosystem which is present. In my research, I also asked questions that what kind of benefit we should provide to the patients, and reply to that even from patients or doctors community was anything coming from pharma company directly reaching out to a patient is always taken with a lot of degree of mistrust unless you are the only one who knows this and you are the only one who can treat this. So my strong suggestion is never bypass the great doctors that we have. It is always better to do it in consultation, especially if that is something which is a need for a doctor to be given in consultation with a patient. I think the last part was, do you have various real life examples? One of the best example which I see is protein intake. We just go buy some big bottles of protein, start consuming it every day without knowing what is the dose. Do we really require it? Is it there in our diet? And when you go into nephrology and you ask some of these patients who end up into CKD stage 1, it's like they were unmindful and they were going on with one consumption of a lot of paracetamol, Crocins of the world, thinking it is NSAID, nothing will happen, end up into CKD, and so much of protein intake which was not required by their body. Okay, so I can go on and on. Baat ka batangad, courtesy Google, and also starting taking treatment, courtesy Google, and also defining who is the best guy. My survey also told the best of the doctors were not there on the social media very actively. If you consult a patient for 15 hours in India, who has got time to do social media? So the best thing to do is who is the best in that particular domain. That's it. And go there, reach out, surrender in front to the person and take his advice. And that's what pharmaceutical companies should propagate.
I would like to add here,
message.
Ashish, I just want to add to Dr. Manoj's point. I think that is extremely important point for the success of the program. Collaboration with the physicians or the treating doctors and closing the loop with the doctors. Whatever you are doing, the doctor should be updated and you should take inputs from the doctor. If we don't close the loop with the doctors, then it's very difficult to make the program successful.
Certainly. So, yes, so I think in addition to what you are saying, Preeta, there is one interesting question which is coming from our past speaker, Manas Das sir, who has been in the pharma industry and who is currently serving as a consultant for many pharma companies. What he's telling is that these patient support program, patient access programs are very good, useful for the patient journey. And the first point of contact, more than the patient and the doctor, what he says is the first line managers and the medical reps who actually go and do a debriefing of the same to the doctors. So what he's saying is that how do you sell the program to the medical rep or the first line manager? So, Preeta
so this
or
is
Sagar,
always,
anyone?
I'd love to add here, and then I'll hand over to Sagar. This is always my first, my favorite point. When I was a few years back, I always used to say my first customer is my medical rep. Okay,
Yeah.
so my boss used to have a big fight with me. No, your first customer is your patient. I said, no, my first customer is my medical rep. So they are the first person, and the program is successful if it is implemented well in the market. Okay, so medical representative or the salesperson and the first line manager has to play extremely critical role in conveying about the program, and not only conveying the program, convincing the program doctors about the program, because so many programs are happening today. Not all doctors are very happy about the program. Pharma companies are running. They feel sometimes we are enriching in their area. Some doctors are, not ready to share the information of the patients because they feel it's they may lose something. So there is some kind of insecurity with the doctor. So it is extremely important to convince a doctor that what is in it for them, what is the benefit for the patient we are offering. And if we run in a proper manner, quality is going to be very important. You just launch a program and that's it. It's not going to work. You have to continuously monitor the quality of the program. If quality are good, patients are happy, doctors will be very happy. So I completely agree. The first line manager in the field are going to play a very, very important role. But at the same time, we have to be very, very careful that they should not take the ownership of the program. They should only convey the message to the doctors. That's it. After that, they should leave it to the patient support program team, because patient data is extremely sensitive what we are dealing with.
Absolutely, certainly. So, Sagar sir, would you like to value add in terms of how you make the first line managers, the medical reps, convince about the patient support program and let them sow the seeds of this program to the doctors, which will later give a very good impact to the patient journey. Sagar sir, would you like to give any inputs to us in terms of how to make it successful and how to convince your medical rep and the first line managers?
So Ashish, I think everybody has given the right points. Just to add on a couple of things, sometimes it is always that chicken and egg story, what should be first, or whether it is patient first, or whether it is customer first, HCP first, or whether it is an internal customer first. I strongly believe we have to understand there is no first, second, third in this. Of course, everything goes for patient. When we know everything will be happening for patient, there is nothing first, second, third. We have to take care that all the stakeholders, not just doctor, not just my rep and first line manager, and not just the patient, but even it can be my medical counterparts in the office. It can be my supply chain. It can be my CFA network, right? Anybody and everybody who is coming in touch with my organization or the product related to that disease for the patient should be 100% aligned on the patient support, because you never know whom the query comes to. Sometimes the query goes to the medical store person who is selling the product. If he is not aware of the support program or this thing, because we go only to the doctor, we don't go and explain it to this thing. Sometimes somebody who wants to take the medicines abroad, he may directly take it from a stockist or a CFA. Even he should be aware, which we lack. We don't do that. So we have to ensure that each and every, it can be my secretary in the office who is a non-pharma or a non-medical person. Many a time some queries goes to her also, because patients don't know where. They know, okay, this is Dr. Reddy's, or this is Novartis, or this is maybe Sanofi. So someone is working with Sanofi. He may be in IT, but the person knows that he is working in Sanofi and this is a Sanofi drug. So he should be also aware. So all the stakeholders, everybody who's coming in contact with this thing should be aware. Yes, of course. Then coming to the sales team and the L&D team, I think it is very crucial that this is not a one-time program. You have launched a patient support program and everybody knows everything. Every month, in fact, there should be a refresher, because we tend to forget. We tend to forget the pointers. I have seen classically, I launched a device which is first time in India, and I'm selling it for 8,000 rupees, and everybody promotes it in different way. Because whatever was taught by the learning and L&D person, everybody has remembered 2 points or 1 point of their own choice, and it is communicated. Only when you go to the field, you realize that. So the right way for the patient benefit is very, very important that everybody should be aligned on this. And definitely while designing the program, first of all, because as I realized my first hand experience, which I had also made a mistake. We designed a program and then we went to the doctors. Doctor said, ideally, you should have taken us into loop while designing. So the efforts and the time to market, time to the patient would have been less. Because we see only inside out. We don't see outside in. They are the people who see all 50, 100, 200 patients in a day. So unless and until we have different doctors from different geographies who are part of devising the program, there are high chances you devise something which is maybe not required or it could have been better. That's where I think we have to take care of all the stakeholders. In short, that's what I would like to say.
So similarly, I think in Medgini, we have also implemented a epilepsy support program for a large pharma company. And this was, it took us at least 2-3 months for the company to take feedback from their KOL doctors in terms of what resonates to them, what is practically possible when it comes to the patient seizure attack being measured properly, and whether it is possible through technology, what should be the limitation when it comes to digital, and what will be the physical intervention. So yes, HCPs are the best person to give you the real-time feedback when you are actually designing a patient support program. It's a very valuable feedback that you have given to all of us, that keep your doctors at the center when you are actually designing a patient support program to make it successful. Otherwise, do a trial and error and hope it works. Yeah. So with that, we come to the end of the session, and I really thank, on behalf of my speakers, I thank my speakers, Preeta ma'am, Manoj sir, Sagar sir, for your valuable time today. It has really been useful. And all the participants who have spared your time today, we will be converting the entire conversation into an ebook format, which will be useful for your business. Before we end the session, please type in one message in terms of what have you learned today, which will be useful for your business tomorrow. So if you can please put that, it'll really help us understand what is the value that we have delivered to you today. With that, we would like to thank you, and we would look forward to see you next month as well with an interesting topic, which will be announced very shortly. Thank you so much. Please type in the message what exactly you have learned from the session today, which you feel is going to be implemented in your area of business. Any last words from you, Dr. Manoj, Sagar sir, Preeta ma'am?
No, I think it is encouraging. We see all sides of the world, and I think whenever you do keeping patients in the center, and you do it a program not with agenda, with an intent that this would benefit the patient's community, it is going to be a success for Access Model.
Perfect. Thank you. So my team is also putting up the LinkedIn profile of our speakers. If you would like to connect to them, please do connect to them. And if you'd like to continue this journey in terms of any queries that you have which are still unanswered because of the paucity of time, please do connect to them, and we'll be happy to look forward to see you in the next session as well. Thank you so much, and look forward to see you again.
Thank you very much. Bye-bye.
Thanks, Ashish. Thanks,
Yeah.
Preeta. Thanks, Dr.
Bye.
Manoj. Again, good having you on the panel and sharing the dice. Thank you so much.
Thank you. Thank you very much.
Bye.
Thank you, everyone.
Thanks for
Thank
all
you,
the
Ashish.
participants.